Oh, good morning, y'all. It is 5:45 right now. And I just brushed my teeth. And I gotta get ready because our kids' dental appointments are today. So I'm gonna start with my hair and get that up and going. And then I will do makeup. I still remember the feeling. I wanna dance till I can't no more. All of this time I've been dreaming on the dance floor. I still remember the feeling. I wanna dance till I can't no more. All of this time I've been dreaming. All right, now I have my hair setting. So I'm gonna get my makeup going. So I have to be remote for the first half of the day because I'll be at the dentist office with the kids. But I have a ton to do, so Tuesdays are my super busy day at work. And I have to use all of Wednesday to catch up, and we have recurring meetings every Wednesday. We do something called chart rounds where everybody in the center gets together and we talk about all the patients that we're currently taking care of, and then we also discuss all the patients that are on our list to get in and talk about like what their barriers are, what they need, because oftentimes we need like certain imaging or we need certain clearances or all of that, or we need them to finish chemo or whatever. So I have to prepare for that meeting today too and get all of my doctor's notes and everything from yesterday done. But I will work on that while the kids are getting all their dental stuff. It's gonna take probably 4 hours for them while they're there. Yeah. So all right. Oh goodness. I don't know about where y'all live, but the weather here has been kind of crazy. It's super hot, but it has also been very wet, which I think it's good, but right now, since it's been a little bit more unpredictable, I think that's what's kind of stressing people out, and it's like heavy downpours and flooding out of nowhere, like flash flooding, but it does keep the heat down. And we tend to have like hot summers with no rain at all. So I guess it's all about perspective, right? I have to go wake up all the children in a few minutes and start getting them going, but I gotta keep my little one from eating because that's the first thing he wants to do in the morning when he wakes up. But since they will be giving him sedation, he cannot eat. I feel bad because I don't think any of the kids, other than my oldest, the other two, like the two middle ones, the last time they had cavities fixed, they also got sedated, and it was several years ago. So they haven't done it not sedated, so I'm a little bit nervous about them too. But all of my kids love the dentist. They love going, they enjoy it. I'm just worried how this is gonna change that for them, especially the 4-year-old, because he gets so excited to go to the dentist because they have, TVs on the wall and you get prizes and, I don't think today's gonna be that day for him. So I'm just a little bit nervous on that aspect too, but I think anytime my child has to get sedation, it freaks me out. But I don't know. I know I'm overreacting, but it freaks me out. See, I keep telling y'all, like, see, the thing is stuck and it doesn't. Now it's gonna move. So I can't get all this stuff out on my face because the roller sticks. And then it takes me an extra, you know, several minutes to get this on when it should take me a few seconds. Come on, Refi, fix this. Because I do love the product. I just want the roller to work properly. I'm done with that. I'm irritated enough. Hopefully there's enough that came out that'll stick the make. I just don't know what's going on in this world. So there's a story right now where I live about this girl that I guess she's 12 and I think she like snuck out of her house or something like that. But I think she was going to meet somebody, but in the process of meeting somebody, she was walking somewhere and these two guys just asked her for directions. And so as soon as they asked her for directions and she told them where to go, they kidnapped her and murdered her. Like, why? I don't understand. And they're also here in the country illegally from El Salvador or something like that. I can't remember. Something like that. But, oh, Venezuela, yeah. Venezuela. That's just crazy. Like, what is the point? I don't understand what is going through people's mind. It's a scary world that we live in, that our children have to grow up in. I mean, this stuff has always been around, right? Like, this stuff has always happened, but it has not been as prevalent as it is now. Like, I don't understand. I feel like people are so, there's a lot of mental health issues. There's a lot of narcissism, way more than used to be. It baffles me, honestly. All right, so I did tell y'all about this, so I'm gonna use this. So this is the Unreal Skin Sheer Glow Tint Hydrating Foundation Stick by Charlotte Tilbury. It just came out, and this is the one I was telling y'all, like, the coloring is perfect for me. Like, you can't even see it when I start putting it on, but absolutely. Okay. So I'll take my beauty blender and just blend it all in. And like I told y'all, it is not full coverage. So if you want more coverage, you can put something over it or you can put something under it and then put this on top for that glowy look. See how the skin is just glowy, so I'm not having to use this with it. It's just like naturally built into this foundation, and it just makes it so nice and pretty. But I really have no coverage, but it's okay because I'm gonna do all of the other things that I would normally do. my concealer and my bronzing and all of that, so it ends up still coming out almost the same.
I still remember the feeling. I wanna dance till I can't no more. All of this time I've been dreaming on the dance floor. I still remember the feeling. I wanna dance till I can't no more. All of this time I've been dreaming on the dance floor, dance floor. Tell me you still remember.
So I'm gonna set it with my Huda Beauty, just so it doesn't go anywhere.
I still remember the feeling. I wanna dance till I can't no more.
I need to go wake up my kids because it literally takes them an hour to get up. I don't know, those of you that have kids, is it the same for y'all? I was always the kind growing up that like I would have my alarm set, I would get up, get ready for school. My parents didn't have to chase me out of bed. I don't know. My kids, you have to go in and wake them up literally for like an hour before they get up, so let me run and do that and I'll be back. All right, went back, woke up all the kids. I'll have to go back again, don't worry. So I will use my dibs. This afternoon, we'll see how they all feel when I get home. That's one like really awesome thing about my job, is that I have the ability to work remote when I need to, like being in leadership, because I have stuff that has to be done and it doesn't matter where I'm at, I can do it. So I'm super thankful for that, because then I can do stuff like this. Like if you're working the bedside, you don't have that option. You have to be at work to do your job, you know? And for me, unfortunately, like on Tuesdays and Thursdays, I have to be in the office because that's our clinic days. So, but outside of those days, I have a little bit more flexibility. But I don't, especially when the kids are off of school, I don't prefer to work remote because I don't want to work with my kids. I would rather go to work. So this is the IT Cosmetics Sun Blush. Y'all, I love this. Like a little bit goes a long way. This is Sun Warmth 30. I got it with the brush, and you just barely put a little bit on there and brush it on there, and then I rub it, or I blend it in with my beauty blender. That way it's nice and blended, and there we go. There we go. See, it just gives you this cute, like, sun-kissed glow. Love that. Sometimes afterwards I'll put like a little, like if it's the weekend or something and I just want a little bit more like cutesy, I'll put this on top of it just a little bit to make it pop, but not today. And then I'm gonna go ahead and put on my highlighter again. I'm almost out of, can't find it anywhere. So, and it's lasted me a long time. I think I bought this almost 2 years ago, and I use this all the time. Fill in these brows. Just because I have a lot of like white in there. So sometimes it can look like things are missing. So there's like a big white hair right there. And yes, I plucked it out and it comes right back.
I still remember the feel.
And this is just the clear gel.
When I dance till I can't no more. All of this time
Now for the eyes. And then back to wake my kids up again. And I usually, like, lately I've been throwing on like some easy dresses for work, but I haven't shaved. So, I mean, I don't think anybody would notice, but I would notice. So, I will, let me see. Yeah, no, I would notice. So, I'll probably wear scrubs today. But I thought it was so funny yesterday because I've been like staying in the office with my physician to help with notes and follow-up things like prescribing medications. And well, I can't prescribe them. I'm not a nurse practitioner. Even though I have my doctorate, I know everybody gets confused. I have my doctorate in leadership, I'm not an advanced practice provider. So just want to clear that up. So I cannot prescribe things without a physician, but like any nursing staff member, we can go into the computer and we can put in orders as what they call proposed. So that way the physician can review them and sign them. So if they agree with what we put in, then they go and they sign it. So then it comes out under their name. It's just we're kind of doing the legwork for them, if that makes sense. So that's what I do for him, is I kind of put all of that in there. But we had to go do an exam on a patient, and he introduced me as Dr. Benita. And I was like, wow, okay. You know, because so many physicians, that's a lot of times where nurses get pushback with the doctorate title, is that they don't want you using it at all. Now, most of the time in nursing, we don't use it in a clinic setting. Or if you do, you just have to be very clear with the patient that, hi, I'm Dr. Benita, or I'm Dr. Smith, or whatever, but I am not a medical doctor. I have a doctor of nursing practice, which is different. But I don't introduce myself as doctor just because I don't want to step on anybody's toes or make anybody mad or whatever. So I was actually super flattered that he was introducing me as our nursing clinical manager, Dr. Benita. I think that says a lot. I don't know if any of y'all are in healthcare or nurses. You might better understand why it's a big deal. But it was very cool. He even put in some of his dictations that, like, Dr. Benita was present with him to perform an exam or to discuss, you know, such and such with a patient or whatever the case is. So, I think it just shows respect, I guess. in a different way. I don't know how to explain it. Like I said, if you're in healthcare or you're a nurse out there, you will probably better understand. But so I thought that was really cool. But yes, now I have to go finish all my notes on those patients and get everything else prepared for our meeting today. You know, having meetings about your patients that you're currently treating is super important. We have it once a week, and we have all of our stakeholders in the room, including our insurance team, our front office partners, our nursing staff, therapists, physics and dosimetry, social work, nurse navigation, our lymphedema therapist from wound care comes over, our dietitian partners come over. So it's truly a multidisciplinary meeting, and it's really important that all parties be present because we all have to make sure that we're on the same page with every patient. And I really like those meetings as well because it gives us that time to be dedicated and pay attention to each other, because usually during the day we're all running in totally opposite directions, and we're using Zoom chat to like, hey, don't forget to do this, don't this, and this gives us that 1 hour of dedicated time to sit and just be present and talk about what we need to talk about and make sure that everybody's on the same page and everybody understands what their takeaways are. So that way we ensure that we're providing the best and safest care to our patients. And it gives the opportunity for people to ask questions if they have any type of question, like, hey, should I do this, or do I need to let them know this? Because that's the other thing too, is in these situations, you know, these people are going through a difficult time, and we have to make sure that they can trust what it is that we're saying and talking about. And so this is also the opportunity for us to be able to make sure that we're all communicating the same message to the patients individually, and we're not contradicting each other, because that is hugely important, because you don't ever want the patient to feel like, you know, you or your team don't communicate, you don't know what's going on, which can ultimately cause a loss of trust, right? And we don't want that. So we do this meeting every week so we can be sure that, again, everybody's on the same page and we all know what's going on and we all know what's being communicated, so we're on the same page. So I will put on my lips after I get dressed, but I gotta go back and wake up my kids because it's 6:30 and we gotta go in 30 minutes. So I will catch y'all when I'm done. Y'all, I just had a total blonde moment and I thought I was recording everything and I did not. So I put on I took my meds, then I put on my favorite lip combo, the Anastasia with the Kim KW and the Buxom. And then I took my hair down and I showed y'all how I fluff it all up. So it was a nice, like, probably 7-minute video. But I'm a moron today and missed it. So sorry, y'all. We'll do another one. Talk to y'all later. Bye.